Hello, everybody, and welcome to CareTalk. My name is Laura Packard, and I'm Executive Director of Healthcare Voter, but I'm also a cancer survivor, and I have been through the American healthcare system firsthand. And I am pleased to bring you a panel of experts to answer your questions about healthcare and health insurance in America. So please keep calling or texting in your questions, and we will answer them in future episodes. Our first question today is from Kevin, who wants to know, how old do I have to be to get Medicare, and can I keep working? To answer that, welcome Diane from Just Care and Social Security Works.
Thanks, Laura. Okay, so this is an important question. There are two ways you can get Medicare. When you turn 65, you're automatically eligible, so based on age. But also, if you have a long-term disability and you qualify for Social Security disability income, and you wait, unfortunately, 29 months, you are then eligible for Medicare based on your disability. So either way, you can get Medicare. And then once you have Medicare, absolutely you can continue working. If you are working and have Medicare and your employer employs 20 or more people and offers health insurance, you also don't need to take Medicare. You can just get your insurance through your employer or your partner's employer, if you have one. But if you don't want the insurance available through your employer, or your employer employs fewer than 20 people, then you can get your Medicare based on your disability or your age at 65.
Great. Thank you, Diane. Our next question is about open enrollment for health insurance through the Affordable Care Act. Can you get health insurance right now if you don't already have coverage? To answer that question, welcome Zoid from Health Sherpa.
Hi. So the short answer is that if you don't currently have health insurance, you may be able to enroll right now. So we are currently in the special enrollment period, which means you need to have a qualifying life event to enroll. So a few of those, you can look those up on healthcare.gov or on healthsherpa.com. But those usually pertain to a loss of coverage, like if you recently left your job and lost your insurance through there, if your COBRA insurance ended. And then also, for example, if you move to a different state and so there are new plans available to you. There is also a category for folks who make under 150% of the federal poverty level, which again, you can look those up, and we also will screen for that when you put in your income on our quoter. And that is a monthly special enrollment period. Otherwise, if you don't qualify for any of these for special enrollment period, open enrollment is coming up sooner than we think. It'll be November 1st. It's going until January 15th, like it did last year. And just like last year, you do need to enroll by December 15th in order to get that January 1st start date. Otherwise, if you enroll between December 16th and January 15th, you'll get a February 1st start date.
Great. Thank you, Zoid. Our next question is from Violet, who wants to know why hasn't the Medicare premium increase to $170.10 been decreased? We didn't gain anything with this increase. Instead, our medications cost and deductibles all increased. Seniors are suffering and can't afford their meds, and Medicare Advantage is no help. So Diane, what's going on? What caused the Medicare premium increase? Is it decreasing? And what can people do about it?
Okay, excellent question. So there was about a $21 increase in the Medicare premium this year, and $11 of it was associated with what the government thought was going to be coverage for Aduhelm, which is an Alzheimer's drug that was going to have a launch price of something like $56,000 a year. And the government assumed that if this was covered, that lots of people would take it and it would drive up, if you can believe it, the Medicare premium by about $11 in and of itself. So this is why we need to deal with prescription drug pricing. As it turned out, thankfully, the government was wise and opted not to cover this drug because there are so many side effects and it's not at all clear that there are any clinical benefits. But as you point out, the government chose not to reduce people's premiums down to $160, which we advocated hard for. They claimed that it would be administratively, legally difficult to do so. But next year, you should see a lower increase in your premium as a result of the fact that you're paying this extra money now. I know that doesn't help you now, and I'm sorry about that. It's just really a disaster. But hopefully it will get addressed in 2023. I know that that's at least what we're being told. The other good news, and we're all knocking on wood right now, is that the reconciliation process package in Congress is looking like actually it might go through. And if it does go through, there are 3 provisions that should help you with your prescription drug costs. One, there's going to be a $2,000 cap on out-of-pocket costs in Medicare Part D, which means that if your medication costs are really high, you will no longer have to pay 5% of the cost once you reach the catastrophic limit. You'll only have to pay out of pocket only $2,000, which is, I recognize, not chump change. It's a ton of money, but at least there is this cap. That, unfortunately, though, wouldn't begin as written today until 2025. The other good news is that the government is going to be allowed to negotiate drug prices for a small group of high volume brand name drugs. That would not begin until 2026. But again, it's a foot in the door to Medicare drug price negotiation, and it should bring down the price of some of the highest priced drugs. So that might help you as well. There's still a debate about whether it will specifically allow the government to negotiate insulin prices, but we're working hard to ensure it does. And then finally, in conjunction with drug price negotiation, the reconciliation package includes a limit on the amount that pharmaceutical companies can raise prices on drugs. And they would be limited to raising prices only to the extent of inflation in a given year. So you wouldn't see more probably than a 3% price increase in a drug in almost any year. This year would be an exception because prices have been really rising quickly. But as a general rule, there would be a much slower increase in prescription drug prices, which is really good news. On the other hand, as we all recognize, prices are so out of control that we're starting with a low base, or a very high base, I should say. And so prices are still high. But anyway, that is some good news. It is a big reform if it goes through. It's only a beginning, but it is really something worth applauding.
Absolutely. And it's something that people, including this group of people, have been working on for years and years. So it's great that, fingers crossed, it might actually go through. And you should contact your senators today and your representative and make sure that they support it, because there has not been a final vote in either the House or the Senate. So make sure your elected officials hear from you that you support the budget reconciliation bill with the healthcare pieces. Our next question is, what are health insurance rates looking like for next year? And is Congress working to lower the cost of health insurance through the Affordable Care Act? Zoid.
Yeah, thanks. So they are still very much to be determined at this point. Congress is working on it. It's actually tied up with what we were just talking about with Medicare. So a little bit of background for those of you who might need a refresher. The subsidies that folks can get on insurance through the marketplace were increased due to the American Rescue Plan Act, and that was for 2 years, and they are set to expire at the end of this plan year, which means that not only would subsidies be decreasing, which means premiums would be going up for folks who are eligible for subsidies through the marketplace, but more likely than not, insurance carriers would be increasing rates overall because there would be fewer folks enrolling, and so they would have to raise their premiums. However, in that same reconciliation bill, that it would essentially extend those subsidies for another 2 years. And so currently that bill is with the Senate parliamentarian to decide whether everything in there can indeed go through reconciliation. For those of you who don't know, reconciliation is it's technically like just a budget process. However, it's often used to kind of get new laws through that are kind of solely about budget, because you don't there's no threat of filibuster. It only needs those 51 votes in the Senate. However, neither the House or Senate have voted on it yet, and the House is in recess for, I can't remember when they come back in, but for about a month. So we likely won't get any updates until September. But fingers crossed, it has a pretty good chance of going through from what we're hearing.
Yeah, and my understanding is the Senate could vote as soon as this week. The House is in recess, but the House, unlike Senate, has remote voting. So if it does get through the Senate and there are the votes in the House to pass it, they could remote vote. So it could happen this month. It could happen in the next couple of weeks if it gets through the Senate first. So again, contact your senators, contact your representative, make sure they know how important this bill is to you and what this will mean for your healthcare. And now I'm excited to introduce our special guest for today, Eagan Kemp from Public Citizen, who's going to be talking about consolidation and competition of medical providers and what this means for patients. So welcome, Eagan.
Yeah, thanks so much for having me. Yeah, it's definitely a challenging time to be an American consumer, what with raising prices on a number of things, and obviously one of the ones that concerns folks the most who are listening here is health and health care. Particularly concerning it should be the One Medical and Amazon merger, which we're seeing. Start the process, and obviously a number of folks are raising concerns given just how much how threatening it would be on sort of a number of issues, but particularly things like workers' rights, things like data privacy, but also just the broader healthcare market.
Great. And so can you step back for a minute and tell us, presumably everybody knows what Amazon is, but what is One Medical? And Amazon is trying to buy One Medical? What's happening?
Yeah, it's a good question. And so the important thing to know is, so One Medical is really sort of it's a mini concierge medical service. And so you pay sort of a flat rate, and it really connects you with the providers within that particular sort of universe of doctors and other providers, and is supposed to allow you sort of better access to like consultations, rapid response should you have a medical emergency, as well as directing you to specialists or other providers in case it's necessary. And it was a bit of a surprise move that this would be Amazon's next jump into the healthcare venture. They had already purchased a prescription drug distribution system, but moving directly into primary care, seems like a big jump for Amazon, who obviously appears to want their toes in everything from owning the Washington Post to Whole Foods, and so this seems like a pretty big step. And there's a number of additional steps that it could mean. Do they plan to just turn this around and try to sell it? Do they plan to farm as much data as they can for a variety of purposes? Or, are they thinking of, also buying, specialty providers, or even moving into, health insurance at some point?
Mm-hmm. And so is this just business as usual with Amazon purchasing something that is out of the ordinary for them? Just like, when they bought Whole Foods, they were getting into groceries, which brick and mortar grocery stores, which maybe seemed unusual. Or is this something different for Amazon? Is this a concern because of their size?
Yeah, it's a great question. I mean, I think it is a concern because of their size and because they are moving so quickly into so many sectors, as you just mentioned. And because it's unclear exactly what they want out of this is also a little bit scary, because the big thing that something like One Medical would be generating that you could anticipate Amazon making use of is the health data of the folks that would be enrolling. Now, there's particularly protections for certain health data in terms of how it's shared, and Apple and other tech companies that have have gotten into the healthcare game have tried to wall off some of the health data from sort of their searches or other things like that. But there's still the potential for a lot of revenue from that data that may be generated, and there may be some information that isn't necessarily protected by law that they could then use. I mean, I've already been hearing concerns about folks who are pregnant being targeted with particular ads, or folks with who are maybe even just doing Google searches for for HIV or for monkeypox, all of a sudden finding different ads or concerning ads, or fears that their data privacy may be violated. And obviously, we've seen a number of different data breaches at big companies recently, which also raises a lot of concern, because Amazon's going to be a huge target for any of those hackers that are trying to get into data systems and turn that data over to nefarious customers.
hmm And speaking of data privacy, what are the data privacy implications of such a merger? And how have other tech companies handled acquisitions? Like I think Google bought Fitbit, or Apple is good with Apple Watch space getting into health data.
Yeah, and it's a bit of a wild west when it comes to to medical data, and as well as personally generated health data. And so for some things, it's pretty clear in terms of if it's something that you've communicated with, a provider, and that provider is then communicating it. But there are ways in which you may sort of accidentally or unknowingly give up the health protections under HIPAA, which is sort of the one of the most relevant data protections for your health information. And it really means that that those can be things that are bought and sold, whether it's to generate ads, or even sort of bigger picture when it comes to things like Medicare Advantage, targeting as you turn 65, whether they're going to target you for ads with different Medicare Advantage plans, or try to cherry pick just the healthiest seniors that may be applying for Medicare Advantage at a certain time.
Okay. And why do you think Amazon is doing this now? Is there a reason why? Is it just that they have lots of money in the bank and One Medical is available, or are there reasons for now?
Yeah, I think the question of now is a good one, because we're seeing lots of private equity money moving into healthcare. We're seeing lots of venture capital money moving into healthcare, and primary care is sort of one of the next big ones that United Healthcare has recently put in a lot of money, and so there is a sort of a bit of bidding wars across primary healthcare, and these companies each sort of have a different footprint. I mean, we know that private equity wants to invest quickly and then return on that investment. United Healthcare is going to be around in the healthcare space a lot longer, and have sort of various uses of directing people from primary care into secondary and tertiary care. But the real question is sort of, what does Amazon want to do with that? And I think their next steps are a little bit less clear. I mean, do they wrap this in with Amazon Prime? Like, does One Medical become one of the things you automatically get when you sign up with Amazon Prime? Is that one more way that then they can send you stuff like, oh, you've just automatically been enrolled in this. Here's a survey to take, and then what happens to that survey data or anything else that they're collecting as they're signing you up for potentially this new primary care e-venture. I mean, they're claiming that they want to change fundamentally the healthcare and primary care experience, but what they want to change it to is not clear.
hmm And speaking of private equity and venture capital, I know that during this pandemic, they have been buying up more mom and pop doctors' offices, and there's a lot more consolidation in that provider space. But recently, just a couple days ago, some reports came out about private equity and venture capital in things like nursing homes and end of life care. So, can you tell us more about that? What's happening?
Yeah, we're seeing various sort of moneyed interests moving into the healthcare spaces where folks are the most vulnerable. And so even before COVID-19, we saw a lot of nursing homes bought up by private equity or venture capital. And some of them had, a lot of them had some of the worst outcomes. Some had sort of as many COVID infections as they had, beds for people to fill. 50% of deaths in sort of the first waves of COVID were among folks in nursing homes, and a good portion of those were in sort of private equity owned nursing homes, which really raises the concern about the ability of these folks to do this type of care. And then moving into end of life care, I mean, that is also particularly terrifying. That it's a very vulnerable time for the patient, but also for their family. And so if they're trying to upcharge people, or they're trying to make provide unnecessary services, we know that there's a lot of spending when it comes to the last year to 6 months of a person's life. And so having folks driven by profit as opposed to sort of a patient's well-being is particularly threatening.
Absolutely, because the whole point of private equity and venture capital is to deliver large returns to their investors.
Right.
And if they're in these spaces, how do they deliver those large returns without compromising patient care?
Exactly. And that's what we saw with surprise billing, really moving into emergency rooms when people were at the most difficult time of making a decision of what care to get, and or may even be unconscious in getting care, but then it being deemed out of network, and then those folks getting hit with tens of thousands of dollars in bill and racking up tons of debt. I mean, we're fortunate that Congress moved on that for a variety of areas. Obviously, there's still concerns about ground ambulances, which were not covered in the most recent surprise billing legislation. But now that that's less easy for private equity to make money, they're definitely looking for the next place.
hmm and how well are private equity owned medical services functioning? Are there concerning examples we should be aware of?
Yeah, we're seeing a lot of concern. Sort of almost every sector of the healthcare system that they've moved into, where we're following them, we're seeing things like buying up an entire medical system and then selling it off for parts, leaving entire communities devoid of a hospital, or certain things within a hospital. We saw when they moved into dermatology, they bought up some of the biggest dermatology networks, and then there was significant allegations of fraud and sort of upselling and referring people for unnecessary services. We see it obviously, as I talked about before, in nursing homes, that really sort of turning profit at the expense of seniors. And even when we're looking at rural hospitals have been struggling for a long time. But and some folks have asked, well, isn't it good that private equity is moving into rural hospitals? But what we're seeing is that within just a couple years of moving into those, buying up rural hospitals, they'll consolidate, remove them, move some providers to a nearer hospital, and it leaves people driving 3 to 4 hours even in emergency care, which obviously is not tenable.
hmm And then, speaking of Amazon's investment, or all of these investments by private equity and venture capitals, is an additional investment in healthcare a good thing? What's this going to mean for patients?
Yeah, I mean, one of the challenges that we have in our healthcare system is just how much we spend on healthcare, and spend it in the wrong places and in the wrong ways. And so, more money in our healthcare system isn't necessarily good, especially when it's folks that are seeking profit as opposed to seeking to help patients as their bottom line. And so I'm definitely nervous about sort of the future of healthcare in America, when I was already nervous about the present of healthcare in America. The more that folks that are really just seeking profit and seeking short-term profit, and even United Healthcare or Amazon that may have longer-term aims, the fact that at some point they're going to need to draw profit out of it or sell it off to somebody else who's going to be even more focused on profit makes me very nervous.
hmm And Diane had a question for you.
Yeah, so I just want to pick up on actually your question, Laura, and your last answer, Eagan, which is, even in the best of all possible worlds, with Amazon sort of being potentially a buyer of healthcare that can deliver more for less in some kind of an ideal world, which is hard to imagine, because much like private equity and venture capital, corporations have to put profits before everything else. But even if their mission was to create something better for people, can you talk to the instability of having corporations in charge? The fact that, an acquisition by somebody else or a new leadership or whatever it is changes everything on a dime.
Yeah, and I think that's what my understanding of folks that have been enrolled in One Medical have experienced over time. That when it was initially started, it sounded like it had a good reputation among its patients, among its providers. But as it focused more on profit, so it became an IPO, going public, there was already sort of a big split. Providers felt like were told that they had less time to spend with patients. They felt like they were having to push them into sort of other services more often. It became more about sort of the bottom line, and it's hard to imagine that changing under Amazon, given the labor concerns that have already been expressed about Amazon's various businesses, whether it was the takeover of Whole Foods, whether it's their factories, whether it's their drivers, you could imagine a number of similar challenges for the doctors under One Medical, and going forward, if they, decide to move even further into healthcare, how far up the chain are they going to go, and what else could you use a primary care, practice or series of practices to fund in future settings.
Mm-hmm.
That seems like the big issue with any private health insurance. And I think why Public Citizen and Just Care and Social Security Works and lots of folks are just supportive of Medicare for All with a public health insurance system, because at least then we have the continuity and the long-term focus on people's health that we're sorely lacking right now.
Yeah, and I think that's one of the biggest challenges is after I experienced Canadian healthcare for a couple of years when I was in grad school, and I think the biggest difference is I didn't realize it could be easy to have healthcare and to get healthcare. I think that's something that's really hard for a lot of Americans to understand, is that we live in such terror of our healthcare changing, it being sold, it being bought, us losing it if we change jobs. But that's just not how it is in other countries, and then, as Diane alluded to, not how it would be under a system like Medicare for All.
Mm-hmm. And what can any of us and or the government do about acquisitions like Amazon buying One Medical, or venture capitalists and private equity firms buying up all these practices? Are there options that the government could take?
Yeah, there actually are a number of things that the government can do, and particularly in mergers like these. I mean, there is the expectation, but we're going to have to push DOJ and HHS to take the steps that are necessary. So, number one, we would like to stop this merger, and we're working with a number of groups to push back to stop this from happening. And so, writing letters, contacting the DOJ. If you go to citizen.org, we're going to have a number of things that you can actions you can take, and also information that you can use, because it really is about pushing back on some of these really bad mergers. And if mergers like this one or other ones that are similar go forward, making sure that there are as strong of firewalls as possible between people's personally generated health data as well as their sort of regular health data, so that it's not being used by other parts of Amazon. And it's not easy for folks that if they breach some of Amazon's data protections to be able to get to people's health data. That health data has to be held much more closely and much more carefully than some of the data that we know Amazon and Google and others sort of have at their fingertips and use for a variety of their programs.
Mm-hmm. And I don't know if he has any authority on this, but I know that HHS Secretary Javier Becerra was pretty instrumental in stopping some of the healthcare mergers in Northern California. Like I think Sutter was, buying up other hospitals and acting in a predatory manner. And I know that Becerra was a champion in that. So does HHS have any authority over mergers, or is this all FTC and other agencies?
Yeah, it's primarily FTC and DOJ, but there often is a consultative role that HHS would play in these sort of mergers, and it's important to put pressure on sort of all of the potential actors. And I think it's also important that you point out, Laura, that there's a lot of things that can be done at the state level, and so contacting your state officials so that they're taking what action they can to block these sorts of mergers, or to stop companies who maybe have merged from engaging in nefarious practices that make it more difficult for people to get the healthcare that they need.
Absolutely. Well, so for our audience, contact your senators and your representative about the budget reconciliation bill, and then contact the FTC and DOJ and others about these acquisitions that are not necessarily going to be friendly for consumers. Thank you again for listening to CareTalk. Please keep calling and texting in your questions, and we will answer them in future episodes. Thanks for listening.